Doug, you've been a patient of mine for about 10 years, and why don't you tell me your thoughts about the use of the microscope and how you value that?
When we first started to look for a new dentist and came to get acquainted with you, we were impressed by the ability to have greater precision. I had recently had a couple of crowns and wasn't all that thrilled with the degree of sophistication, and it seemed like at times, you know, both arms and a foot were being used to try to get in the back corner, and I was very interested in the degree of trying to be more precise, at the same time trying to help me see what was going on in my mouth, at the same time improving what you could see.
Now, you say in terms of you being able to see, how was I able to accomplish that for you?
We were able to see on what you were able to tape and play back to us on the screen exactly what the condition was that you were describing that I didn't know how to get a mental picture for. This gave me a very good picture. I could see it. I could see what you were describing in the way of decay or in the way of things that needed to be worked on, and that made me better informed and better understanding of why it was you needed to do the procedures you were recommending.
Now, we did have a number of things that we decided to do, correct?
Yes.
And how long did it take us to actually accomplish it?
Probably about 2.5, 3 years. We had a plan that included a couple of cavities that needed to be replaced. There was a crown that wasn't in the greatest of shape, and then some stress lines in teeth that I had never known I had before, that eventually included, you know, wearing of a night guard, something that I'd never been counseled about or suggested was beneficial, but being able to see in greater precision, almost vein lines or you know, cracks, really helped me understand what was going on in my mouth.
Now, did we balance your bite as well, equilibrate it?
Yes, yes.
And how did that feel in terms of getting that done?
The process was pretty straightforward, and I could notice a difference pretty quickly. You know, that combined, you know, as I never really paid much attention to it, except, you know, things just weren't quite meshing right, and the fixing of the bite and the balancing meant that I was not noticing one particular part of my mouth more than another.
And before that time, what was happening to your teeth before you had it balanced?
Before I had it balanced, I had the feeling that maybe it's just a combination of age, maybe it's just that, you know, some things weren't right, but I was noticing it, whereas now I don't.
And then, you know, since you've had your bite balanced, you haven't had any, even though you have the stress fractures that you saw in your mouth, right. Have we done any crowns for you?
I've had one new crown in addition to replacing one.
Okay. Now, was that from the original grouping of
yes.
crowns?
Yes.
And so, really, since we balanced your bite, have you had a new crown?
No.
And
no.
so we've been able to make everything hit evenly, so that
yes.
you wouldn't continue to break teeth. And
right.
so that's a real
right.
benefit of the balance. And, you know, we use the computer to do it at the end so that everything hits evenly. Right. And so between that and the night guard, you've been able to really, for the last 10 years, well, the last 7, be able to be pretty well free of any work.
Yes, I mean, I don't think I've had any new teeth come under scrutiny, if you will, or needing major work since we got all that accomplished.
Well, I have people that are in their 80s that have been with me for over 20 years, that once we've gotten them into a night guard, balanced their bite, they really have never needed another crown. And so that's what my hope is for you.
Great. Well, thank you. That'd be wonderful to achieve.
Thank you. This is a picture of a tooth using a microscope. So you can see the little black dot. That's still a little bit of decay. With the use of the microscope, a dentist is able to see the tooth even in a greater way and make sure that all the decay is out of the mouth. You can see how the tooth is 20 times bigger than normal, and the dentist can come along and clean that out. So that all the decay is easily removed. And afterwards, a wonderful filling can be placed. The final result allows us to place a filling that is bonded to the tooth and that is polished smooth, and the patient should be able to have that for many years to come.